Bird's Eye View.
Okay, hi everybody. Welcome back to another episode of Bird's Eye View. Really excited today. Have one of my longtime friends and one of my longtime mortal enemies that I've got as a guest on the show today. And we're going to have an opportunity to speak about things that are really relevant right now. Obviously, COVID remains highly relevant, and the entire Black Lives Matter movement continues to dominate the news, rightfully so. And my guest today will bring an interesting perspective to that. Hope everybody had a great Father's Day. Hope everybody's having a great and productive week. And I think we should just probably get to it today. I don't know if I could get this done in 10 minutes, but to introduce this guy, again, he's one of my oldest friends. He's a Toronto Montessori alum, as I am. He's the Chief Department of Family Medicine at Joseph Brant Hospital. He's the VP of Business Development in a business. He's a medical director of a medical professional center. He's a member of a science advisory committee, and he's a really shitty basketball player. But I'd like to introduce him. Arshad Hack, welcome to the show.
Thanks, Kyle. I appreciate that.
How was that for an introduction?
That was actually perfect. It met my expectations.
I think it really encapsulated our relationship the way I did that. At the same time that I brought you up, I also knocked you down a peg, right? Over
the last 37 years, I've become accustomed to that.
That's great.
And thankfully, it goes both ways.
It absolutely does. Yeah. When I get to be a guest on your show one day, I can only imagine what I'll have to deal with. Arsh, we just spoke about what you do for a living. Obviously, it's in and around the medical profession in a variety of ways, but certainly being at Joseph Brant Hospital, you're exposed to COVID and everything that's going on with that. You know, we had Paul Perlon on a couple of weeks ago, who gave us his perspective as far as Mackenzie Health in Richmond Hill, out in Burlington, out in that area. You know, what are you seeing?
So I got to be honest with you. So I was an integral member of the pandemic planning team for Joseph Brant Hospital. And when COVID started to come, we were really scared. We thought that our hospital was going to be completely overrun with COVID, and that we were going to have a high demand for intensive care beds in the hospital and acute care. And so we didn't wait. We acted and prepared ourselves as best as we could to the ability to ramp up our ICU beds in the hospital to about 150, 100 of which were ventilated if necessary. We also built a pandemic response unit, which was a very nice military-style tent juxtaposed to the hospital that was able to accommodate 100 patients of sort of lower to moderate acuity, all of whom were COVID positive. So as a hospital, we were very prepared for the onslaught of COVID to come. Very fortunately, we never saw that onslaught. At any point in time, the maximum number of patients we had in our ICU were about 5. We have had some deaths in our ICU from COVID, but fortunately not very many. In the hospital at large, the maximum number of patients at any one time was in the range of 8 to 10. So again, very good. At this current moment, we only have one COVID positive patient. We went 2 weeks without having a COVID positive patient. And the numbers in Halton look tremendous. I mean, for Doug Ford to allow Halton to enter into phase 2 this Friday ahead of other parts of the GTHA really speaks volumes to how low the numbers are in this and sort of Southwestern Ontario. And I think a big part of that just has to do with the fact that people are paying attention to the precautions, wearing masks, physical distancing, hand washing, keeping their physical circles and bubbles, to the sizes that are recommended.
And I mean, we know that people are physical distancing. We know even just between us, you haven't invited me over to enjoy your new pool yet. So, I mean, I can speak to the fact that you're exercising that.
You move too often for me to keep track of your address.
We've heard that from Paul Perlon when he was on. We hear that from you now. I've spoken to other doctors or people involved in your profession and hear the same thing. So we were prepared for the worst. It didn't even come close to that. Was it hyperbole? Was it too much?
Was it a pandemic? I have to say no. When you look at what's gone on around the world, I mean, you can only deal with the best information that you have at hand when you're trying to make decisions and plan. When you look at China, when you look at Italy, when you look at the United States, there has been lots of travesty and death and inhumanity, loss of dignity that's occurred. And so I would say that you can't minimize that. And it was responsible for us to prepare and to continue to be prepared for a second wave or a third wave or ongoing waves, for the next while.
I get it. But I guess one of the positives is that at least we know that we're fairly ready, or what we need to do to be ready for that pandemic that maybe does come to fruition as maybe unexpected, right?
Yeah. And it was scary. I mean, I think right now I think the system is a lot more prepared than it was. But as you know, just watching the news, things like personal protective equipment availability and having appropriate human resources in place, whether that's nurses or PSWs or even doctors, was very challenging early on. And had the numbers been higher, it could have been devastating.
Right.
But already in the long-term care sector, it has been devastating.
Yeah, fair enough. Switching gears a little bit, still on COVID, you got a family practice or have a family practice. Has that kind of the levels of patients coming there returned to normal, or is that?
So it's interesting. I mean, I feel like a light switch went off overnight, and we had to like change the way that we practice medicine in the snap of a finger. Currently, I'm seeing probably the same number of patients per day that I saw before, but the majority of those patients are using virtual technologies. So surprise, surprise, healthcare was really ancient when it came to information technology and use of computers. But now we've got virtual tools. I can do video conferencing like this with patients. I do a lot of phone calls. I've got email. I've got secure messaging. I've got a lot of different things that I can do to provide care to patients in their homes. So that's keeping them safe. It's increasing the patient experience and allowing me to continue to do work from home also. Now, that being said, I'm in the office about one full day a week for about 8 to 10 hours, where I'm seeing those patients that absolutely need to be seen. So that's like the young kids for immunizations, newborns, pregnant people, my geriatric patients, chronic pain patients who need treatments. And we're in the process, and now that we're entering phase 2 of ramping up our resources in the office, and each doctor, we've got 6 docs, so each doc will be in the office 2 days a week. So we're still not going to have a waiting room area. Your patients are still going to come in and go directly to a room that will be terminally cleaned upon their leaving, but it allows us to do more of the health maintenance and managing the chronic diseases, which over the last 3 months have been put on the back burner.
Yeah, so I mean, it's like every other industry. I mean, you'll return to some level of normal, but it'll be a new normal, right? There'll be new things in place.
Absolutely.
So on the COVID topic, but now bringing it to what's dominating the news right now as far as the recent protests in support of Black Lives Matter, and doubtlessly the further protests that will continue, and again, rightfully so. What can people do to be safe from COVID? Obviously, they want to provide as much support as they can for a cause they believe in. At the same time, we don't want to undo everything that we've done, as a society from a health standpoint, while we do want to undo everything we've done from a systemic racism standpoint, as ironic as that is.
That's really well put. I agree with you 100%. And I thought about it, and one of the things when I look at the news that I'm most amazed about, regardless of where the Black Lives Matter protest is taking place, is that the majority of people that are out there are wearing face masks. It's very difficult to physically distance when you're in that kind of environment with those numbers of people, but wearing the face mask does decrease transmission rates significantly. Obviously, having eyewear to protect the mucous membranes of the eyes would be that much better. Some people are wearing sunglasses or eyeglasses or whatnot, but not many people are wearing face shields. But having the mask itself is really great. And then, prior to eating or doing anything like that, obviously, hand washing reigns supreme in. And so wash your hands, sing happy birthday twice when you're doing it before you put your hands to your mouth or to your face. I'm a huge supporter, obviously, of Black Lives Matter and the protests that are going on around the world. I think there's a wonderful appetite for humanity right now, and like the hashtag #MeToo movement that really took flight and changed the world, hopefully forever. I'm really hopeful that this movement will do the same.
Yeah, likewise. You're a Guyanese doctor, man. You've told me, so I know the answer, but can you describe any racism that you've experienced in the field of work? Maybe not even just in your personal life?
Yeah, absolutely. I have to be honest with you. I've been really blessed to not have too many examples of racism that I've personally been involved in, but there are 2 that I do remember that resonate with me. One occurred when I was working in Connecticut in one of the VA hospitals, and there was a gentleman who came in the room and said, "Aren't there any American doctors that can see me?" And so that took me off guard, and I knew exactly what he was referring to. But the second episode was sort of like here. It was actually when I was working in Hamilton. There was a patient who came in and said, "Oh my gosh, you can't find a doctor nowadays who isn't brown." And when you look at those two things, I mean, it sort of rolled off my skin like water. It wasn't as hurtful as many have experienced, but it is an example of racism. And one of the things that I feel blessed about is throughout my training, you're taught to understand the context of your patients and understand where they're coming from and how they think and how that influences on their health and how they act, and also trained to never act out in the negative countertransference. So because somebody is raising feelings and emotions within you, like you might want to say F you and react. You don't, because you're trained not to. You're trained to understand that emotion that's going on with you, but then act with kindness and empathy. And I think that that's the way that I reacted in those moments, by saying, unfortunately, there's nobody else here to look after you, but I'm here. I care. Please share with me. I'm here to listen and understand and help. And each time that really diffused the situation.
Yeah, and I can only imagine. I mean, obviously, I'm white. I've never really experienced any racism. Given a background where my mother's Italian, my father's Ukrainian, and my father and I talked about it on the last episode. We've never. I mean, you were my best friend. I mean, people may be wondering why. I don't know why. I mean, I'm taller, better looking. I'm a better athlete than you, funnier. But yet, I guess something about you resonated with me, and we became best friends for our whole lives. I don't care. I just if you're Muslim, if you're Catholic, if you're white, if you're black, if you're brown. But I guess if we really put it into the context, systemically, that's not the case. And people have these inhibited feelings towards somebody or towards a culture or a race that wind up coming out, and they think there's nothing wrong with what they're doing, when in fact there's actually so much wrong with what they're saying or doing, right?
Yeah, no, we've minimized it and made it okay for so long. And we've come up with excuse after excuse that's just unacceptable. And so hopefully at this point, you say that I'm Guyanese, and it's, in the Caribbean, it's a beautiful place where there's so many different cultures. There's Black, Indian, Chinese, Portuguese, British, white, Aboriginal. Everybody sort of gets along very well and celebrates each other's cultures and religions. But despite all of that, there still is systemic racism. There's racial divide. And growing up, I recognize how that impacted on even the way that I thought. And so through this movement, what I've been able to do is be mindful and try to recognize and understand any sort of discriminatory thoughts and beliefs that I have that potentially shape the way that I act, I think, I educate my children, and change that. And I think by changing that, as the generations move on, we'll be able to rid ourselves of this.
You just brought up your children. You're a brown man. Your wife is a white woman. Your kids are growing up mixed race. Mm-hmm. You teach them anything differently than, especially with something that's going on right now, as a result of what's happening with Black Lives Matter? Or do they experience racism in any way amongst their peers?
Yeah, no, it's a really good question. And I have to be honest with you, my children have not experienced anything that would come close to being called racism. And for that, I'm very fortunate. We teach them about inclusiveness. We teach them about love. We teach them about treating individuals as they would want to be treated themselves. I mean, there's a lot of basic tenets that are found in every single religion, for instance, and that's what we teach our kids. And they're aware of what's going on in the world right now. Like Lucian, my 8-year-old, watches the news with us at nighttime, and he was, makes me emotional. He was devastated when he saw the videos of what happened, and had a lot of questions. It was George Floyd, had a lot of questions about why that happened and how that could have gone differently.
And I think so many of us, I mean, look, I can't speak for the state. You would actually be able to speak to the States because you went to school there, and you spent a lot of time there. But, even here, I mean, growing up, you and I both had friends of all shapes and sizes and colors and ethnicities. I mean, that was our school back then even, right? So, I mean, it was just the way we grew up. Where does it shift? Where does it happen? Not to say that you and I have changed, but people then change as they grow into adults. We're not born to hate. I mean, we all see that image that goes around on Instagram, right? And, in your opinion, where does that happen?
So two things. So you talked about living in the States, and one of the stark differences from living in the States, regardless of the state that you live in, there are white areas that you live in. So like the suburbs, and then there are Black areas. The divide is very, very clear. And I noticed that as soon as I moved down there as being something that was starkly different to how life in Canada is. And that really bothered me. So the second question that you asked sort of around, when does some of that change happen? I would argue that even in those young children, there are thoughts that are there that they're hearing from their parents that just don't come out. And as they get older and they have different experiences, and particularly once they enter the economic world of work, I feel as though that's a time where you start to separate and you start to discriminate. And we see lots of liberal people turn to conservatives. There is a shift that takes place around that time.
Larry and I touched on it on the last episode. It's not even just giving Black people opportunity or the Black community opportunity. It's about give them the same opportunity for leadership roles thing. And I think that might be what's missing, where, you say you can't, or somebody shouldn't do themselves justice in their minds to say, well, I gave that guy a job. Yeah, but did you give him the same job that you would have given an opportunity for a white guy or a white girl or something to that effect, right? And I think that those may be the subconscious things just because of the way that things have always been done. And that's what they're talking about with systemic racism, is that you might not even realize you're doing it. It's built into the system and it's happening, right?
Oh, 100%. That the statistics don't lie.
No, that's right. I guess closing off, this part of the conversation, what positive action would you encourage in our viewers? Like, what are positive actions that you could recommend, as far as taking action and even thoughts that people can challenge themselves with?
Practically speaking, I try to lead by example. And I think what I said, by taking some time to be mindful and recognize any inherent biases within yourself in your own sort of thought process and psyche is really important. And then try to understand where that came from, and speak to your family, speak to your friends, speak to your kids, and try to help them understand some of those things about understanding what systemic racism is. It's very disheartening to see the Premier of Quebec say that there's no systemic racism in Quebec. And so clearly what that means is that people just don't understand what it means. And I think by having dialogue with those close around us, it's an easy thing that we can all do and advocate. I think the second thing is just educate yourself about some of the history. So, for those of us growing up in Canada, we don't really know very much about American history, and we don't really know about slavery and what went on in America to Black Americans. And I think understanding some of that will help with the contextualization also.
Right.
And then lastly, I think there's so many wonderful movements that are going on right now with respect to supporting Black businesses and just not affirmative action, because I think that's actually belittling, but providing equal opportunities for everybody, and keeping the conversation going.
Yeah, the conversation I think is really the key. I have my next door neighbors are Black, and one day I just started talking to them both about it, the husband and the wife, and I think we, maybe spent about half an hour, 45 minutes talking. And at the end of it, I think everybody was appreciative that we had that conversation, because it was almost like it was the elephant in the room. And it's not, we shouldn't be afraid to talk about it, especially if our hearts and intentions are in the right place. Right. So,
yeah.
Listen, this has been great. And I really appreciate you coming on. I'm just asking everybody to, number one, tell me what they're drinking, because I know you're not drinking milk in that mug of yours. And number two, leave me with a funny story that's happened through all your experiences in COVID outside of your hair.
Oh my gosh, the hair is probably the funniest of the bunch. I got to be honest, through COVID, we sort of got into Moscow Mules a little bit, and different gins. I've never been a gin drinker, but one of my neighbors dropped off a bottle of rhubarb gin, and I got to be honest with you, it's very refreshing.
I'm going to send you. We have one of our great clients, Magnata Winery, who you know as well.
Oh, I know very well.
We have a long relationship with Magnata, actually together through school. Has a gin called Ingenious, and I'd be happy to send you a bottle, or even bring you a bottle as I jump in your pool and let you try that. But it's absolutely phenomenal. So I'll get you onto that stuff.
That sounds great. Now, funny stories. I'll be honest with you. Through COVID, I've been working like 16 to 18 days because of the responsibilities in the hospital. But when we were building that pandemic tent, we had 2 weeks to erect this tent, to get all the HVAC, to get all the equipment. And we needed everything to line up perfectly. And everybody in the whole world wanted hospital beds at the same time. And so we found some and we got them shipped to us, and they were supposed to arrive at 8 p.m. on a Thursday so that we could clean them all, assemble them, and put them in the tent to be open for Friday. And they never showed up. And the amount of conspiracy theories that we came up with respect to who stole our beds, that was probably the best. And you can just let your imagination run wild, and anything you come up with, we thought about.
Arshad, it was Trump. I think we all know that.
Yeah, well, there you go. There you go. Oh my gosh. There's humor right there.
Yeah.
Anything the man says is humor.
That's right. Basically, and it's getting worse by the day, right?
Oh.
Listen, stay well, stay safe. I want you to know that as a frontline worker, and literally on those front lines, thank you. Thanks that you and all your colleagues and that you're doing to keep us safe. And I'm glad that you haven't had to use all those beds, and I'm glad that you haven't had to use everything that you're doing. But thanks for educating us. Thanks for teaching us. And obviously, we'll stay in touch as we continue to get through this together.
Sounds great, man. Listen, thanks so much for having me. Appreciate it.
All right. Thanks, Arsh. That's it for today, everybody. I hope you found that insightful. Arshad's got a lot of experience in a lot of ways surrounding both the things that we've talked about today, whether it's a medical issue or something that's a little bit more systemic, like racism or discrimination or anything of that sort. So again, hope you found it interesting. Happy to have you again next week. Thanks for joining us. We'll see you then. Take care.
Bird's Eye View.